Good afternoon and welcome to Webinar Wednesday. Today we are joined by Greg Thomas, Medigate Sales Engineer, and Ross Sweetser, Cisco Healthcare Business Solutions Architect. Webinar Wednesday would like to thank our sponsor, Medigate by Claroty. Medigate by Claroty is the industry's first and leading dedicated healthcare IoT security platform, enabling healthcare providers to safely deliver connected care. Medigate fuses its deep understanding of medical workflows and proprietary protocols with the reality of today's cybersecurity threats, so hospitals can confidently connect and operate all clinical assets on their network while ensuring patient privacy and safety. To date, Medigate has won more than 40 industry awards, including 2021 and 2022 Best in Class for Healthcare IoT Security, the Cynit Innovator Award, Fast Company's Most Innovative Company Award, and being listed in Forbes' Top 20 IoT Startups to Watch. To learn more, visit medigate.io. Just a reminder to save the date for our spring MD Expo. We're headed to the Woodlands Waterway Marriott Hotel and Convention Center in Houston, Texas, April 11th to 13th, 2023. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more details, please visit mdexposhow.com. Today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. Let's kick off today's webinar by giving away one of our brand new Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. October is Adopt a Shelter Dog Month. What is the name of Charlie Brown's dog? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Greg Thomas and Ross Sweetser are our presenters today, and we'll be discussing Every Byte Counts, why device detail is the foundation for effective network security. Greg, you may begin whenever you're ready.
Welcome to our session on Every Byte Counts. Today we're going to be discussing not only how the more detailed and granular information you have about the medical devices communicating to your network, how that affects security, but also how the effective security controls that you can put in place by having that information may also extend the life of those devices. I am Greg Thomas, Solution Engineer with Medigate by Claroty, and we are a medical device security platform and visibility platform for healthcare exclusively. And I have the pleasure of discussing this topic today with Russ Sweetser. Russ, do you mind giving an introduction?
Yeah, thank you. Ross Sweetser here. I'm a global healthcare solutions architect with Cisco, and I come to Cisco from the healthcare provider space. So I'm not the typical Cisco employee. I'm here to help both our sales field and our customers translate the technology business into the healthcare business. So I worked for 25 years in healthcare IT, and I'm fairly proud of my partnership with the facilities and operations and biomedical engineering teams and the health system that I worked in. So I'm really happy to be here today with Greg to speak to everyone. Thank you.
Okay. Almost every week now we wake up and there's a new report of another healthcare organization that's been breached. FBI just recently published some documentation stating that healthcare, you are now the target of these breaches. And the reason for that is the hackers have learned that patient health information, it is much more lucrative than trying to capture credit card information or social security numbers and so forth. And you know, with your background in healthcare, your many years of experience, Ross, and now that you're at Cisco, the most prevalent network provider around the globe, what is it that you're hearing about all these new attacks and things from your customers?
Well, I think that the key thing here, Greg, is that the information is important. This is why hackers are going after it, because the access to the information or blocking that access to information, which could impact health and human safety, is financially viable, right? So the targets are there. Customers before WannaCry, so before 2017, wanted to have a strategy to address this, but it was not a priority for them. It wasn't really until it started to impact their wallet and in different legislative domains, the security and privacy breaches that came about as a result that actually pushed them over the edge and into a place where they were responding. And I think every healthcare provider today wants to build a solution that is the most secure. I think we get a little bit into what the ideal is later. Greg, if you want to carry on, let's go to the next slide.
Yeah, and so, we're installed in about, 200 customers right now. There's over 1,600 facilities, around 200,000 beds. As we speak with customers, more and more customers are upgrading and expanding, and, they're choosing to purchase new devices that are network capable only. Whereas before, when we go into organizations, a lot of times, a majority, not a majority, but around 40–50% of the medical devices were attached to the network. And today we see upwards of 75–80% of those medical devices are now attached to the network. And that's not only because these devices need to communicate, upload data to back-end systems, speak to other providers with different hospitals and things like that, but it also helps the organizations to try to better manage those medical devices as well. And with this rapid increase of all these new devices that are now being attached to the networks, is it affecting how you at Cisco, how you deliver services or how you work with your customers at all?
Well, I think there's two things there. We've had biomedical devices connected in some way, shape, or form to deliver telemetry for a long time. It's only been in the last, but we'll say 10 years. You're showing that converged access growth from 2019 on this slide. It's only been in the last 10 years that we've started to see a practice, and I would say that as you stated, about 75% of the healthcare providers that I speak to today now have a converged strategy. So in the past, we had, we'll call it security by obscurity. We ran an isolated biomedical network. We didn't secure the devices on it, but we kept that network autonomous. Now that we actually need that information, let's say to add into an AI data lake, or we want to do research or other things with that data post admission, that we need to collect it, we've needed to connect those biomedical networks into the IT network in some way to collect that information. And so more and more, this convergence is actually being driven by a clinical need rather than by an operational need, let's say. So we need a way to protect those devices that are connected now in this shared domain, this domain that's no longer isolated.
Absolutely. There's a lot of different challenges, in healthcare specifically, unique challenges that you only find in healthcare. Oftentimes what I see is there are multiple vendors for devices that are actually attached to the network. And oftentimes there's not a central management system to manage all of these different medical devices. And they're also managed by different groups within the organization. You may have clinical engineering that's responsible for, some of the devices, but they are not really focusing on securing the devices. And you have IT and security that are trying to get a handle on all these devices and things as well. So what are some of those largest challenges that you see and some of the complexities in your large customers?
Well, so I think that the number one thing is that anytime we're addressing health and human safety, we have a very cautious approach. I sometimes call it 100 ways to say no, right? It's very difficult to move forward, let's say, with a policy where we're going to react to changes inside of an environment without addressing whether or not that device is being used for clinical care. And you did raise the stakeholder challenge as well, right? Radiology has a different set of needs and requirements to biomedical engineering, right? So you've got portable ultrasound machines, some of them still running Windows XP or Windows 7. They may or may not be able to even install antivirus software on them. You've got 20-year-old infusion pumps that connect through Wi-Fi. You might have head wall monitors that connect and aggregate connections. You could have computers that look a lot like a serial aggregation device, still running Windows 7 in ICUs to collect information from different places of telemetry. And the reality is that it's difficult to lock all of those down and deliver a consistent security policy across the organization.
So how are your customers adapting to some of these challenges that they face?
Oh, well, I think our partnership with you is one of the ways that they're adapting to those challenges, right? They need a policy-driven solution that helps them identify which devices are the ones that are most vulnerable, and build a policy of zero trust that makes sure that only the things that need to talk to that ultrasound, that ultrasound machine can only talk to the PACS DI repository that it needs to send images to, that it can't infect all of the other Windows devices that are on the network if it is compromised. All of those things, I think, are the things that we're seeing. And so, as you've outlined with this slide here, right, we're really in this place where we're at this oh wow moment. We know we have these challenges, and lots of customers are struggling to keep the lights on. I think that 10% of organizations that you show on the right, they've understood that they need to have an approach that enables integration and automation, because we just can't manage the number of devices at scale without a programmatic way to address it.
Yeah, I don't think there's anyone, today in healthcare that is at phase one that they're, not aware that they need to address security for the medical devices. But, how many of the customers out there would you say are starting to develop risk management programs that are actually focused on managing the risk that those medical devices pose within the organizations?
Well, I think it depends where you are in the world. Today, I'm fortunate enough to be on the road in Portugal. I speak to customers all over. That in lots of places, there's regulatory requirements for risk management. So that there may be a strategy or a risk management policy. How those policies are applied are different across organizations. And I did see a question here from Ted about what mechanism. Ted, we've actually got a slide a little bit later that will show exactly how this is being done. So I hope that's okay for us to just wait just a second to respond.
Yeah, absolutely. Yeah, so most of the journeys, begin with device identification, device discovery. And IT and security, they can't use the same tools that they've been using, to discover PCs and understand what vulnerabilities those have. They can't use those same tools when it comes to the medical devices, because again, patient care, first and foremost, you have to maintain, patient care. You don't want to introduce any harm to the organization. You can't scan these devices and knock them offline because you don't know how those devices are being used. So utilizing a passive discovery method to identify those devices and capture as much detail as possible about each device. So learning that you've got 500 infusion pumps really does not help you to determine how you're going to mitigate risk for those devices, how those devices are being used, and so forth. You must really get very granular in the detail that you discover about those devices, such as the make, the model, the manufacturer, what are all the known vulnerabilities for this device? Has the FDA issued any recalls for that device? And once you have that information, you're then able to make some decisions about how you're going to secure that device, and you also improve the efficiency and the operation of that device. Maybe that device, you've got 300 devices in one facility, and you can move some of those devices to another facility to improve the operation at that site. So Ross, when it comes to discovering the devices, I know you work very heavily with us, and we partner with you guys to provide that discovery and identification for the devices. Without a good discovery tool, have you seen anyone that's able to implement a cyber resilience or security or risk mitigation program?
So I think the question would be, and I'm just going to paraphrase if I hear right, what does a comprehensive discovery solution look like? So we've got typical discovery mechanisms where we can look at a profile, let's say a hardware manufacturer address, or even in a moderately segmented network, we can maybe look at where that device has come from. But the reality is, without some form of probing, it's very difficult to know. It's very difficult to know what that device is doing. So we depend on a partner like Medigate to be able to look at the traffic. And I think this gets back to what Ted was asking. So there's a portion of the passive discovery that comes from information that's provided when the device connects to the network. But there's also a portion of information that Medigate does an incredible job of looking at once the device is connected. And I don't know if that's the next slide or not, Greg. I can't remember from an order perspective. But the reality here is that that without these things together, it's very difficult to know what that device is, and more importantly, what the device is doing at this current time. So you provide a passive way to also view what is happening. I hope you can hear me, because I just got a note that I'm experiencing network difficulties. Am I still online?
We can still hear you.
I don't know if we want to move forward, Greg. Sorry. Good.
Yeah, absolutely. And one thing I'd add here, one of the largest customers that I was working with. Go ahead. Yeah, so I was going to say, one of the largest customers that I was working with in our region, once we did some discovery for them, they were able to identify devices, not only devices that they were not aware that they had, but also all the outdated operating systems that they had in their environment. And in this particular case, I was working with someone from the security engineering team. And as soon as they saw those devices, the first thing that they wanted to do was just shut off the entire network segment. They could see that, hey, I've got a whole bunch of Windows XP devices out here, but they had no idea that those devices were medical devices. Once we categorized them and showed them that, hey, this is actually a medical device, it's not just a PC running XP. They understood, well, I can't just go and shut that network segment off to protect my infrastructure. And the question became, what is it that we can do to mitigate risk for all those devices that we have out there? And that's where our partnership with Cisco comes in, because as you mentioned earlier, Ross, in a lot of cases, the medical device manufacturers, they have not introduced a patch for those devices. And they don't allow you to install any type of antivirus on them. It requires them to go back through a certification process with the FDA. So once you've done that discovery and you do understand that, hey, I've got a lot of vulnerabilities out here, I've got a lot of outdated operating systems, the question becomes, what is that I can do to mitigate that risk and protect the rest of my infrastructure from these outdated devices? And in most cases, the only protection that you can put in place for those devices is going to be some form of network protection, either doing VLAN isolation or utilizing a Cisco network access control to mitigate the risk for those devices. Okay. Are you still with us, Russ?
Yeah, I'm just muted because there may be some challenges. I think the other part of this relates back to, again, the second question that Ted has asked here, which is really important. It starts with maybe a hardware address, but it's more than that. Medigate looks at what the device is doing, and so a device that's behaving like an infusion pump is going to continue to be connected to the network like an infusion pump. But a device that pretends to be an infusion pump from a MAC address, but is communicating with a command and control network, let's say for malware, is not going to remain connected to the network. So I think there is a little bit more than that. And I don't know, Greg, if you can get into that in a little bit greater detail. I'm speaking from my my outside knowledge, but I think it has to start with that first connection to the network, and it ends with a comprehensive knowledge of what that device is and how that device should communicate, and how clinical zero trust actually works, because this can't work in an environment where we don't isolate or profile or segment the medical devices in a place where they can operate safely.
Yeah, absolutely. So, I mean, as you mentioned, it begins with device identification, getting as much granular information about that device as possible. And then from there, once you know what that device is, you must also understand how that device functions in the environment. What are the clinical workflows? What does the device need to talk to, and so forth. And from there, creating the policy. So when it comes to network access control, one of the fears that I had, my background is route switch, network engineering, and security. For medical devices, I had no awareness of what those devices needed to communicate with. I did not understand what their function was within the organization. And so what we have to do is we automate the policy. So we understand what these devices are, we understand what they need to communicate with, and from there we build the network access control policies that are then used to apply to these devices to prevent them from, if they do get attacked with some type of ransomware, prevent them from communicating back to a command and control server, and only allow them to communicate with the things in the organization that allows them to function. Okay. Yeah. Now, one of the other advantages of being able to identify the devices and implementing a security control on the network is it also can extend the life of the medical devices that you have as well. Can you tell us a little bit about that in your experience, Rob?
Yeah, so this is actually something that I communicate lots of times to the internal team here at Cisco, but even to IT teams that it may not be evident to. When we see, I'll use a 737 in the air as an example. Like all of us have climbed onto a 20-year-old airplane sometime over the last few years, right? And in fact, with the 737, we were trusting the older ones rather than the newer ones. More recently, there's a process to keep that plane in the air, and it's a set of B checks and C checks that the FAA mandates. And you, as long as you maintain that maintenance schedule, that airplane stays in the air. Well, the FDA has similar processes for medical devices, and so as long as you're maintaining your infusion pump to the specifications that are required of it, it remains a viable infusion pump. And there's no advance in technology that makes one infusion pump, let's say, necessarily substantially better in a clinical outcome than another. So some of them may have more functions for higher levels of acuity, but they continue to operate the way that they were designed to. They deliver medication over time. And so no one's running out to buy new ones simply because this device, is 20 years old and there's no security or software patches for it. And so this presents a huge challenge in that converged IT environment where, we would like to protect this infusion pump because, we don't want somebody to hack it and accelerate the delivery or cut off the delivery of medication to a patient. And at the same time, we can't touch the pump itself. Biomedical engineering can't update the pump because there is no firmware. In fact, the pump manufacturer may not even exist in the state that it did when it was purchased 20 years ago. And we can't spend millions of dollars just to simply replace pumps because there's no software updates. And so, as an organization, we need to respect in IT that old medical devices are not necessarily obsolete devices.
Yeah, and extending the life of those medical devices, in your case, infusion pumps, that's another way that organizations can mitigate costs or reduce costs in the very restrained budgets that are in healthcare right now.
Well, it's one of the ways that they do, and it's not just infusion pumps. So I think I'll use a portable ultrasound machine as another example, right? When you're paid per study, or when your costs are funded on a per study basis, let's say for the use of that ultrasound machine, a newer ultrasound machine doesn't really let you perform more studies, per hour, and so there's no additional revenue. And the quality of the study may impact patient care. So we might see newer ultrasound machines, again, going to higher acuity, but until there's a substantial change or a substantive change in the clinical outcome provided by the ultrasound machine, there's no benefit to a health organization to go and buy a new machine. So similar to the infusion pump, as long as that device continues to work in the manner that it was designed to work, we're going to continue to keep it. And so unfortunately, that means that you're going to continue to run Windows 7 and even in some organizations, Windows NT on infusion pumps that are out there in the field.
Yeah, and so being able to automate this entire process from the discovery and identification of the devices to implementing the security control around those devices with Cisco NAC is what we provide to healthcare. Security engineers, guys, they don't have to build policy from scratch. Our solution is 100% passive in the discovery and identification of those devices and profiling those devices, being able to group those devices together and also updating the inventory. So if a customer has a CMMS platform, oftentimes those platforms are manual entry. As they purchase new devices, they may enter those into that system and then they never update them. So as the operating system may change and maybe the device has patches that have been applied to it, no one goes back to enter that into the asset management platform. And our discovery solution, everything automated, we're able to do that in real time for every medical device discovered on the network. Another benefit that we recently introduced is the ability to discover those devices with the existing Cisco infrastructure that a customer may have. So if they have Cisco switches and routers all over their network, they don't need to install any new hardware whatsoever. We can leverage their existing infrastructure to do that discovery and integration with Cisco ICE as well. Okay.
So Greg, we have a question from Michelle, and I think it fits very well. Michelle View, it fits very well with this. So when you ask about how do we protect, for instance, an infusion pump as an example that we cannot replace, and one of the unique features of the Cisco network is the ability to run logical or a clinical zero trust or a zero trust network based on logical tags instead of dynamic access control lists. So we can use a security group tag, which technically is simply a designation in the frame that enables us to drop or forward traffic. But again, based on a set of business-based or security-based rules, rather than based on a set of source and destination addresses. So one, this reduces the amount of memory that the devices at the edge need to dedicate towards forwarding, and it also reduces the amount of compute that's required to filter in those access lists. It's a very simple lookup and a drop. And so this enables you to scale your security group across your organization regardless of the layer 3 domain that the devices are connected in. And then the other part of it that Greg, you alluded to was, if we can use that Catalyst 9K switch, which is the most popular switch we've ever sold, and it is present in half of the hospitals that I'm aware of in the US. That particular switch could provide that collection or that compute capability with an integrated service or container, so a microservice running on the switch that enables you to, at the very edge, be able to profile that device passively and investigate the traffic without building complicated ER span networks or crowding a data center with collectors.
Yeah, very easy for the team implementing. The hardware is already in place. Simply add a module and we start collecting that traffic and identifying the device. It's very, very light lift. Yeah, so here's some of the ways that we also help customers, and I'll get into another here in a bit, is again, the automated process of giving you that visibility, building out that policy, applying and restricting access to these devices, restricting what they can communicate with, has all kinds of cost savings as well. In this example here, Trinity Healthcare, one of our largest healthcare customers in the country, they utilized our joint solution to do the discovery and implement a risk management program that was tailored around, grouping the devices together, understanding what their workflows were, and mitigating the overall risk that the organization had from the medical devices. Now, another added benefit is the ability to do location tracking for the devices as well. I can't count how many organizations that I've worked with over the past couple of years that their number one objective when we got into the environment was to not only understand how many devices they had, but where are those devices located. For them to go out and perform routine maintenance, preventive maintenance on these devices, they spent countless hours running up and down the hospital floors, looking in closets, trying to find, say, for example, infusion pumps. And with the Cisco DNA, most of the customers using Cisco DNA, Cisco Wireless and DNA Spaces, we have the ability to extract all the maps from that system and pinpoint exactly where a device, which access point a device is connected to in real time. A lot different than trying to do this. I have some customers who are actually trying to do this within Cisco DNA or within Cisco Prime. And within that system, you'll see a device, you'll see an IP address, and you can determine which access point it's connected to, but you don't have all that rich context about that device. You can't sort and filter for that device. And what we allow you to do is you can come in, if you have, for example, say a infusion pump from a particular manufacturer with a particular model, that you want to see where all of those infusion pumps are located across your entire organization. It's as simple as coming in and doing a simple filter, and we'll display that to you and show you exactly on the map where all of those devices are located at in real time.
So I actually think that this is a key differentiator for Medigate. You're the only medical device profiling organization that I'm aware of that also builds location context into your application. And if you're a Cisco DNA Spaces customer, or we've rebranded the Cisco Spaces customer today, then you can leverage this capability in conjunction with Medigate. So you may be using Spaces today simply for, let's say, infant abduction protection on your pediatric unit. Well, if you built that connection, the capability to be able to track other devices is there. And one of the things that's magic about DNA Spaces is that because it's a cloud-based and an API-driven solution, a partner like Medigate can leverage this information to help you, but you can also use this Spaces solution to determine room occupancy, or again tie back to other clinical use cases or health and human safety use cases with other partners.
Yeah, and the ability to understand where the devices are in real time. If you do have a security incident, being able to go and retrieve that device and perform whatever investigation to determine what happened to the device is also very critical as well. Okay. All right, so I'm going to open it up for some questions here. Do we have any more questions coming in from the audience?
Right, Greg, we've got a few questions here. The first one is, how can this joint solution help reduce the cost of managing our medical devices? Who wants to answer that?
Okay, yeah, I'll take that question. So to reduce, how do we help you reduce the cost of managing your medical devices? First and foremost, when you're making purchasing decisions and you're trying to determine how many new devices do I need to purchase, if you don't have an accurate inventory of those devices, you really can't make a decision on how many new devices do I need. So we track all those devices, we discover them, we tell you exactly where they're located. We also can see the traffic from those devices in the workflow, so we can give you utilization metrics to tell you how often that device is being used, when it's being used, how it's being used. We can also tell you, for example, for radiology devices, how many scans of a particular type that device has performed. So you can use that information to make decisions on how many new devices do I need to purchase? Do I even need to purchase new devices? Do I need to move the devices around to different facilities? Maybe I have a device in facility A that is used 90% of the time, but I've got some devices over facility B that are barely ever on the network. So this is how we help you to mitigate and reduce the cost of managing and utilizing the medical devices. Would you like to add anything to that, Rose?
No, I think you summarized that well.
Yeah.
I think that there is an obvious savings with convergence that happens as well. So if you are running parallel infrastructure today to deliver security, there is a savings in being able to converge infrastructure. But as we alluded to earlier, we're seeing more and more providers have converged that infrastructure and are already realizing those savings with Cisco.
Okay, that's great. Well, another question here is, what value does this platform provide to my inventory management system?
Oh, absolutely. I'll take that question, Ross. So for your inventory management system, like, as I mentioned earlier, in most cases, what I see in healthcare is those systems are manual entry. So you buy a new device, someone keys that information into that asset management platform. They may go back and look at it as they're doing preventive maintenance and make a few updates, but these systems, it's not an automated process and it's not real time. What we're able to do is we discover the device, everything that we learn about that device, we can immediately share that with that inventory management system, right? As changes occur with that device, say for example, you update the operating system, add a new patch, we can also automatically send that over and update that information about the device. As the device roams around the organization, we can share location information with your asset management platform as well. So as you're logging in to do preventive maintenance, so you want to know where that device is because I need to go retrieve it. Maybe I need to apply a patch or do some type of repair to that device. You know exactly where it is. So you have all that same real-time information that we collect about the devices. We share that in real time to your asset management platform. Okay.
Okay,
Any
another
other
question.
questions?
Yeah,
Okay.
we have. How are the medical devices located?
Our discovery solution is 100% passive, and that means that we do not interrogate the medical device. We know that is a bad practice with medical devices. You can't use a scanning tool to perform a brute force attack on a medical device to try to extract information to determine what it is. So what we do is we listen to traffic. So as a device connects to the network, whether it's a local area network or wireless network, we listen to that traffic stream and we perform a process called deep packet inspection where we extract information out of that traffic stream to identify the device. Now, medical devices are oftentimes the hardest devices to discover simply by listening to the traffic. And the reason for that is medical device manufacturers, they don't publish the protocols in most cases that these devices are using to communicate across the network. And so we have a lab, we do testing, we write parsers that allow us to pull just the information that we need out of that traffic stream to get a definitive identification for what that device is. And once we have that, we display that to you in our dashboard. We group all the devices together based off the FDA category. So you'll know immediately how many patient devices I have, how many makes and models, how many different operating systems and so forth for each of those devices. And based on what we learn about the device, we can do correlation. We subscribe to ECRI, we get feeds from the FDA, from the manufacturers. We can also tell you immediately how many known vulnerabilities does this device have? Has the manufacturer issued any recalls for the device? Are there any FDA notices for this device and so forth? But our discovery and identification method is 100% passive. The first rule is introduce no harm. We don't want to introduce any harm to the environment. And so therefore, we're just going to listen to a mirrored copy of the traffic as these devices communicate.
Okay, we've got one question just popped up, which is how do you ensure real-time tracking all medical devices traffic does not weigh down on your system?
Yeah, so again, our discovery method is passive. So we're just listening to a copy of the traffic. So as these devices communicate in the Cisco infrastructure, we can get a copy of that traffic. So we're not in line, so we don't introduce any harm. And the traffic is not going to weigh down our system. Again, we're just listening to a mirrored copy of the traffic and parsing that traffic to make that identification for that device.
I think that the other thing that's a key here is that a vast majority of medical telemetry is small low latency frames or small low latency packets. So the actual burden on the network is relatively small or the burden on the sensors is relatively small in comparison with the other traffic that may be present on the network.
Okay, so how do you verify the data you attribute to a device is accurate?
So, Greg, I don't know where the slide was that actually showed the frame. There was you had a slide that showed a packet or a frame, but it maybe we went past it quickly, or it maybe got filtered out of the
Yeah,
presentation.
I think that's filtered out. So the way that
Okay.
we make our discovery process again is definitive, and it starts with understanding the protocol that the device is using to communicate. Within that protocol, there are device identifiers, typically in the header of that packet. And we pull that information out. There may be a sequence of hex numbers or binary that tells us exactly what that device is, the make, the model, the manufacturer. We also capture the application version, the operating system version as well. But all of that information is contained within the traffic to give us that definitive identification.
Okay. We don't appear to have any more questions come in, so I think we'll wrap up now. So thank you, Greg and Ross, for your time today and for such a great informative presentation. I'd like to encourage everyone to visit today's sponsor, Medigate, to learn more about the products they provide to our industry. So visit medigate.io. As promised, the answer to today's trivia question is Snoopy. So congratulations to our winner, Christine Thorne. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. Thank you again for joining us today. Hope to see you next time. Enjoy the rest of your day. Bye.